Thank you, Mr. Chairman, for yielding. Thank you for scheduling this hearing, and thank you to each of the witnesses for the work that you do and for taking your time to hold this discussion. I think it's important we hear from you as we look at reauthorization to understand how we can improve the program to ensure that care is delivered as effectively and efficiently as possible. I talked recently, or heard recently, from the Lancaster County, I represent 11th District in Pennsylvania, the Lancaster County Children and Youth, which is the child welfare agency there. And similar to some of your testimony, they described sort of the complications, the difficulties that they face with accessing federal funding from many different programs, and each one has their own requirements, own reporting mechanisms. And in fact, this agency said that they actually employ a fiscal staff, 7 people, just to track which pot of money they're accessing, where the money's coming from, what requirements it entails, and other details. There's another program in my district, Thrive to 5. They said they have a finance team of 10 individuals, again, just to manage the federal funding requirements. So let's streamline this thing, because if we can do that, both of those organizations, and probably yours as well, could spend more time meeting the needs of each family rather than spending all the time on administrative work. So I see a lot of heads nodding. Does that sound familiar to each of you? So I do think it's really important as we look at this, how we can help you better deliver your services. I think, Ms. Gruber, I'll ask you, we're looking at several different subparts here, Title 4B, and other subparts. Do you think they could be combined? Do you think that would help streamline it? What should we be looking at? What suggestions do you have?
Thank you, and yes, all of the above. I think if you're just looking at Title 4B, is one funding stream that through authorization you have the ability to actually address. I think combining subparts A and B, establishing clear outcomes, combining definitions, making sure that those definitions are the same, and reporting requirements. And your example is spot on. We have over 20 staff just administering federal funds. We're a small state, and the administrative burden is significant, and it takes away from the frontline workers. For one of our funding streams, not this one, but for foster care, our staff are tracking 196 different data indicators. It might be time to evaluate whether or not those indicators are actually necessary to ensure the health and safety of the children that are in the child welfare system.
I think it's certainly I'm sure you agree with all of us that we do need accountability. We want to ensure that the programs are working well, that there's accountability for the federal dollars. I don't know if you have any thoughts about that. Like, how can we streamline things? How can we reduce the requirements, the regulations, but still ensure that there's accountability in the program?
Absolutely, there has to be accountability, and all the states would understand that there needs to be accountability, and the accountability has to be balanced with making sure that the health and safety of the kids are met, which is all of our objectives, and keeping them in safe and stable families, and evaluating the various reporting requirements is one way to streamline. With Title 4B specifically, just reorganizing the structure, given that they were 2 subparts at very different times in our country, 1935 and I think 1993. It now is a great opportunity for reauthorization to revise that framework, and maybe even consider, as I provided in my written testimony, an opportunity for us to pilot some comprehensive approaches that allow us, with outcomes defined by policymakers, to maybe think creatively and allow states to innovate to meet the needs of their populations.
Well, I'm out of time. I had some additional questions, but I think this is really important as we consider reauthorization that we have this good discussion. So I think your input's going to be really, really important going forward. And again, I thank each of you for being here.